Hey, good morning, everybody. It's Anne Sinclair from Digestive Detective. Sorry about last week. It wasn't a fun week for me, or fun day anyway. Lots of vomiting, and I think, to be honest, I brought it on myself, so that's even worse. So we won't talk about that anymore. So I hope you had a great weekend. Today we're going to talk about nose breathing. And this is a topic that has not been new to me, but I've sort of really got onto it from a teeth perspective initially to start with. And I've seen lots about it, and I thought I would do a little self-experiment and try some things out. So this is what I've found out. So ideally we want to breathe in through our nose and out through our mouth, because we all know that breathing provides our body with oxygen it needs to survive. So it also allows us to reduce or release carbon dioxide and the waste that we make as well. So a lot of us are mouth breathers of a night time. I know I am. I sometimes wake up with a really dry mouth, a sore throat, and feel really unrested. And sometimes I actually wake myself up snoring, so my husband says. But I think at times I do breathe quite heavily through my mouth. So mouth breathing in children, they know, can lead to things like crooked teeth, facial deformities on where your jaw sits, can have problems from a teeth and a gum perspective, can make your mouth really narrow because you're not getting the right amount of oxygen, and it can also give children poor growth. So in adults, chronic mouth breathing can cause bad breath, gum disease, cavities. It can also worsen symptoms of other illnesses. And a periodontal disease is a really big one for mouth breathing. So reasons that children breathe through their mouth: habit, because they've never really learnt, we never really learned to breathe properly. Enlarged tonsils or adenoids. A deviated septum is another reason for kids to be able to do that. And some of the reasons adults breathe through their mouth, again, is habits, a deviated septum, which is a big one, medications, sleep apnea, and from being overweight. So when we breathe through our nose, we produce nitric oxide, which improves our lungs' ability to absorb oxygen. So nitric oxide increases the ability to transport oxygen right around our body. So, and what the other thing it does is it relaxes smooth muscle and allows blood vessels to dilate rather than be contracting. So nitrous oxide is also antifungal, antiviral, antiparasitic, and antibacterial, and it helps the immune system fight infections. So we want more of it rather than less. So teaching ourselves to breathe with our nose instead of our mouth is really good. So your nose acts like a filter, and retains small particles that come in through the air, including pollen, and it stops them from blowing in right up into your sinuses. So that's what nose hairs are for. And the nose, the other thing the nose does is it adds moisture to the air. It gives to the lungs to prevent dryness in the lungs and bronchial tubes. The nose also, who knew there were so much great things about your nose, also warms up cold air that's coming in to your body, warms it up to room temperature or to body temperature before it gets to the lungs, so you're not putting cold air into the lungs. One of the really biggest benefits of it, it helps relax our nervous system and puts it into that parasympathetic rest and digest, where from a physiological level is where we want to be, rather than in that sympathetic fight and flight response. When we're in that, we tend to be really shallow breathers. It tends to be rapid and it tends to be quite abnormal. So how do you know if you're a chronic mouth breather? Snoring, dry mouth, hoarse throat, you wake up really hoarse, you're constantly tired, chronic fatigue, brain fog. This is a big one for me, dark circles under your eyes. For a long time I thought that was allergy, and I've been going down the allergy path, but it's slowly getting better. So what can you do to fix that? A couple of things that I've investigated over the years. There's a type of breathing called Buteyko breathing. They teach you how to breathe through your nose. And it's reasonably inexpensive. It does take a long time to learn, as do most things. It's not a one thing you do it and it's all fixed. Or you can do something that I'm trying. So I've bought these little strips from an American company called Somnifix. And what they are, they're little, I haven't peeled this one off, but they're little strips that go over your lips overnight time. They stick on. And the strip it's got a little air hole in the middle, so you might be able to see that through there. So you can still breathe out of your mouth, but you're just not having that open mouth breathing. So I've been doing these for pretty much 3 weeks, most nights. And I've noticed a difference to a couple of things, and I'll tell you what the difference are. So my sleep quality, I'm waking, like I'm a really early riser, generally at 5 o'clock, but for the last 6 to 12 months, I've gone through this real period where I struggle to get out of bed. So this is now, I'm if I go to bed at 9:30, I can be up at 5, and I'm awake and I'm energized, whereas before I was just dragging my bum out of bed. The other thing is I have periodontal disease, and I have one tooth that's been problematic for years. And my periodontal disease is slightly different to most people. Mine is not caused from bad hygiene or anything. It's caused from a genetic perspective, and basically my mum lost all her teeth at 17. And in mine, the little pockets, the little strings that hold on the teeth just break off. So one thing I've noticed that this has really helped with that, because the one tooth that I had that was problematic would always be in pain and bleeding, but not bleeding every day. But now I've noticed that there's no bleeding at all. The tooth actually stopped being pained. My gums have stopped bleeding forever, so I hope that continues. The black circles, hi Deb, have become much less under my eyes. The other thing that I noticed this morning when I was doing it is for people who clean their tongue and tongue scrape, I've noticed a lot less gunk on your tongue, and it's been a lot more easier to clean my teeth, because I haven't got that plaque build-up which you get when you sleep with your mouth open. So it's been quite easy. I've actually been able to keep the strip on all night. So they do say that some people can't. So I think that they're easy to use. I'm going to continue to use them for 3 months. I've bought 3 months supply, so I'll keep you posted on that. But some other things that they talk about with the nitrous oxide as well, and when I talked about smooth muscles, one of the reasons people wake up in the night is because their bladder's constricting and they need to go to the toilet. Well, this has been because it's relaxing smooth muscles, I found that to be of benefit as well, that I'm not actually getting up in the night a couple of times to go to the toilet. So so far so good. I'll keep you posted, but there's some really great testimonials and stuff on these guys' websites. So they're called Somnifix. They really weren't that expensive for me to ship here, and I'm sure shortly that they'll be able to get here. And they are super easy to use. They are not constrictive in any way. To be honest, I don't even notice I've got them on once I use it. So I hope that has been useful and interesting. Go back, guys, and watch the whole lot, because it's about nasal breathing and strips, how they've really helped my black circles under my eyes and things like that. So I have noticed that a huge difference for me. The black circles have almost disappeared, but not quite. So I think try it, give it a go, and see what you think, and keep me posted and see if you have any benefits. So I've had quite a few, so I'm going to keep doing them, and I'll keep you updated. Have a fantastic day, girls. I hope you all have a good one. See you, bye.